So today we're going to talk about inserting a peripheral IV catheter. It's important to remember that there are several different types of IV catheters that can be inserted. In your clinical skills book, you'll often see the term VAD, which stands for vascular access device. Keeping in mind there's lots of different vascular access devices such as PICC lines, central lines, and what we're going to be talking about today, which is a peripherally inserted IV catheter. Before we actually go into the skill of inserting an IV catheter, I want to quickly go over some of the supplies and equipment that you're going to need in order to do this skill. First off, you're going to need an IV catheter. Keep in mind that there are several different types of IV catheters. One of the biggest things you'll see is different facilities use different types of brands, different types of IVs, so they're not all going to be a cookie cutter. But one of the things that stays consistent is there are different sizes of IV catheters. They're arranged in gauge sizes. So a typical IV gauge that you'll see is anywhere from probably 18 to 22. They're pretty universally color coordinated. So you'll see a 20 gauge is associated with pink, 22 with blue. One of the things you want to keep in mind when you're picking what size gauge to put in for your patient is that first off, the smaller the number is, the larger the IV catheter is. So a 20 gauge is actually a larger bore needle than a 22 gauge. And one of the ways you're going to decide what to put in for each patient is that you need to figure out what kind of therapy they need, such as blood will need a higher gauge IV, or if the patient is an elderly patient with smaller veins, they may need a smaller catheter. Notice here I have two different brands of IV catheters that are also two different sizes. You'll notice on this one particularly here, it tells you that we have a 20 gauge and that it's pink, as opposed to this one here, we have a 22 gauge, which is blue. Just like I said, different IV catheter brands will look different. You'll notice here that the 20 gauge does in fact look different than the 22 gauge, the difference being the safety chamber that's on it. However, these are both IV catheters that you can use for peripheral IV access. Some facilities that you work at will actually have an IV start kit that will have some of the supplies that you need already in them. Keep in mind though, not all facilities will have these, so what I'm going to do is actually just discuss the specific supplies that you'll need to start your IV access. So one of the first things you're going to need is a tourniquet. A tourniquet is used to impede venous flow when you're starting the IV catheter. So you have it like this. A second thing that you're going to need is something to clean the arm with. Some IV start kits will come with iodine. Keep in mind though, if your patient has any allergies to iodine, that's not something you're going to want to use. Frequently iodine will come in prep pad form or sometimes in a gel form ointment. If you're concerned at all about your patient having any kind of iodine allergy, you can always just use an alcohol prep pad. Other things that you're going to need to start an IV is you're going to need an extension tubing set. Oftentimes you're going to hear these called a J-loop, hence J. This is going to be used to hook directly to the IV catheter. I'm going to go ahead and open this up to show you what it looks like. It's going to look like this. The second thing that you're going to need to go with this is you're going to need a saline flush. Typically saline flushes these days come pre-filled with 10 cc's of saline already placed in them. Again, check hospital policy. Keeping in mind though that most hospital policies these days, or the equipment that they use, is a needleless system. What I mean by that is we have luer locks and we don't actually stick needles into the tubing, and I'm going to show you exactly what I mean by that. So this is the luer lock, and hence with our J-loop right here, this 10 cc saline syringe is going to actually luer lock onto this piece here with no needle whatsoever. What you're going to see though is I want to go ahead and I want to pre-fill this with saline, because like I said, this is actually going to connect to our IV catheter, and when it does connect to it, we want to make sure that we're flushing saline through it and not air. And the easiest way to do that is to simply push saline right through it. So to secure your IV, you're going to need a tegaderm, which there are different styles of tegaderm. I'm going to go ahead and show you the one that we have right here. Basically, this is what's going to secure your IV in place. You're also going to need transport tape, which is going to additionally help secure the IV to the arm. A few other things that you'll see in a kit or that you might need when you start an IV is sometimes they'll come with a little 2x2 gauze. This can be used in case there's any kind of blood or bleeding, anything that you need to clean up. Sometimes some will come with a Band-Aid just in case you're taking out an old IV and you need to cover up that site. And finally, what you'll need is a little sheet of paper here that actually has cath date and time and initials on it. The purpose for this is after you start an IV, you're going to want to date and time exactly when you put that in. The purpose being that IVs are only good for a certain amount of days. Different hospitals have different policies. A very typical policy is every 72 hours an IV needs to be changed. So that's why we want to label them so we know exactly how long that IV's been in place. So after identifying my patient with 2 patient identifiers and explaining the procedure to them, the first thing I'm going to want to do is I need to find a vein. So to do that, I'm going to apply my tourniquet. I'm going to usually apply it 4 to 6 inches above where I'm looking to insert the IV catheter. And I need to make sure that this tourniquet is tight, but not too tight. Next, you're going to want to select a vein for your IV insertion. With your fingertips, palpate the intended insertion site by pressing downward. You'll note a soft, bouncy feeling while you're pressing. Temporarily release the tourniquet and go ahead and clean the IV site that you're planning on inserting the IV catheter in. Clean for 30 seconds and allow it to dry completely. Reapply the tourniquet. Anchor the vein below anticipated insertion site by placing your thumb 1.5 to 2 inches distal to the site and gently stretch the skin against the direction of insertion. Instruct the patient to relax. Hold needle bevel up and align the catheter on top of the vein at a 10 to 30 degree angle. Observe for blood return in the catheter or flashback chamber, indicating that the bevel is up and the needle is in the vein. Release the tourniquet and stabilize the catheter with your non-dominant hand, making sure not to touch the insertion site with your hand. Quickly connect the lower lock end of the short extension tubing with the needleless connector to the end of the catheter hub. Secure the connection. Pull back on the catheter to assess for blood return, then slowly inject normal saline from the pre-filled syringe into the vascular access device. Observe for any swelling, redness, or pain that your patient may be having while you flush the device. Clamp the J-loop so that you do not get any more blood return flushing back into your line. Continue to stabilize the catheter with your non-dominant hand. Grab your tourniquet, remove the backing, and place the tourniquet over the IV insertion site in order to secure the IV. Make sure that the entire IV insertion site is covered by the tegaderm. Remove the outer backing of the tegaderm.